Hi, everyone. Thank you for being patient. We're just waiting for a few more to trickle in. But my name is Gabrielle Riley, and on behalf of NMatch, welcome to our second PD series tonight. I'm just going to quickly do some housekeeping and kind of explain the format of tonight, and then I'm going to quickly introduce the NMatch board, and we'll be able to move on. So to try to make this as effective as possible, we just ask that everyone stay muted and keep their cameras off, besides PDs and the NMatch. And if you have any questions, feel free to put it in the chat. PDs can answer if they are able to. We also will be going through the chat and kind of filing away some of the questions to ask later on if they end up not being answered. So no worries with that. We are going to answer the questions that were sent with the registration form. So we already have a list of questions that we will be asking too. So thank you. But yeah, so I'm just going to go through the board real quick and they'll just do a quick wave and then we will go on. So first, Neha Saini, Laura Joanna Inaru, Haley DeVille, Maya Ramey, Nancy Lay, and Andrea Mendez. So welcome again. I will pass this on to Laura.
Hi, thank you. Welcome again. Big welcome. I have the pleasure of introducing our PD panel tonight. But first, I just want to give a heartfelt thank you to our PD panel for voluntarily collaborating with us to make this event possible. So from this NMatch 2024 leadership team, we thank you. So let me introduce you to our PD panel. We have Dr. Alexandra Duffy, Program Director of UC Davis Adult Neurology. We have Dr. Krishnaiah, Program Director of University of Tennessee Adult Neurology. We have Dr. Sarah Rizin, Program Director of Baylor Pediatric Neurodevelopmental Disabilities Program. We have Dr. Erica Schuyler, Program Director of University of Connecticut Adult Neurology. We have Dr. Colleen Tomcik, Program Director of University of Rochester Adult Neurology. And we have Dr. Tyler Allison, Program Director of Children's Mercy Kansas City Pediatric Neurology. Thank you. And I will now pass the mic to Haley to begin our questions for the panel.
Good evening, everyone. So our first question is, how large of a role do USMLE scores play when deciding whom to interview, and to what extent do programs have filters, but also practice a holistic review of applications?
I can take this one. As you all know that we get hundreds of applications, and I don't want any application to be missed. Every program is different. I do not use any filters at all. The way I do this is, if I say I review 500 or 600 applications, I'm lying. So I have a pool of faculty. We have 12 faculty who reviews all the application. We'll review all our criteria. I give them 30 applications per faculty. I give them 4 days to finish the review. And then, so it's uniform. All of them does the implicit bias training. If you see the minimum number of pages I see in one applicant is 30 pages. And then we want to make sure we go through everything. And we have a criteria for what to look for: personal statement, how to assess their passion in neurology. Research is not must, but we look into that. The letter of recommendations, we read through every single word that you had to put in. We don't want your time to be wasted, and that's how we do it. And we are fortunate enough to have a diverse group of faculty in our program, which represents every continent in the world. So I give them the applications that are pertinent to the place where they come from, so that they know their background, what does it mean, and the letter writers, what does it mean by that? They can read between the lines. So that's how we screen our applications. To answer in one line, we do not use any filters in our program.
I'm happy to share our side too. So we also don't use any filters. We look at the whole application and perform a holistic application review. I review all of the applications. We look at every aspect of it. We look at scholarship broadly. So we're looking at research, volunteer work, QI, community outreach, and value all of those experiences equally, because some people really kind of focus on others. You can't do everything, right? So we look at that. And we look at kind of the new pieces, such as meaningful experiences for things like path and distance traveled, because a lot of people have overcome additional challenges outside of the normal challenges of going through medical school. So we like to look at the whole person and different varieties of life experiences. Some people have had other careers before coming to medical school, and so all of that's equally important to look at. We do look for things like failed exams. So if we're looking at scores themselves, it's not so much like a minimum score cutoff, but hey, have there been failed attempts or remediation or things like that that would signal something that I need to be a little bit more aware of. But we do review all applications that come across and give credit for everything that's been experienced, including path and distance traveled.
And pediatric neurology is a smaller group, and I can't speak for all pediatric programs, but we don't use filters here for our program. And then within NDD, we're even a smaller group. So of course, we each, a small group of NDD faculty review all of the applications. I actually personally start with the personal statement. I actually love the personal statements, and but everybody will have their own kind of approach, but the whole application is reviewed. And I did what you both have said as well. And we're fortunate that we're just a smaller group.
And on that PD side, yeah, same. We review all of them. Dr. Duffy reviewing all of them. Wow. I'm happy to have help with Dr. Fitzgerald and splitting it in half. But yeah, we look through all of our applications. And when it comes to anything that is what people would call a red flag. Sometimes there are extenuating circumstances for that. You need to be able to review the entire thing to see the whole person. So this is, I think this is something that is relatively uniform across a lot of places. Yes, there are some that do filters, but I'm not sure that that's one that most neurologists ascribe to.
Okay, thank you guys. That was really helpful. I'm going to go ahead and pass it to Maya at this time.
Hi, everyone. Thank you. As seen in the chat, the American Academy of Neurology recently released a statement for the 2023 to 2024 residency and fellowship application cycle. In this statement, there are many guidelines outlining what they recommend programs do, what they recommend applicants do. We were hoping that some of you here today could comment on that, maybe the largest points in there that you think would be helpful for us as applicants, and that might be top questions that people have.
So I'll take that one just because I first authored it. I just want to give a little history of it. So obviously I think this is the third year we're doing all virtual. And I was chair of our program director organization when COVID hit. So for those couple, those were the years that we had to switch over. And so I chaired the work group that put together guidelines because virtual recruitment was completely new, right? So no one had ever done it before. It was our first year going through it. And we really tried to get some consensus from our organization in terms of what were sort of just general guidelines. And we've revised that year over year and tried to include data in terms of how many programs on average our applicants should be applying to and interviewing at and ranking. Because one of the things that makes things really difficult sometimes for programs, so I have 7 spots and I got 1,200 applications last year, right? So, and on average, if you look at the data over time, applicants are applying to more and more programs every year, which makes it harder and harder for program directors to know who's actually interested. And as a result of that, that's when we started adding these other factors to the application, such as the geographic preference and the signaling, just so programs can have some idea if we get flooded with applications who's interested. Now, when we look at the data, and I'm going to emphasize this is an important part of the statement, is to look at the data. And if you want to look at the source of the data, look at NRMP and ERAS data from the past couple of years matches, and you'll see that for the most part, and I'm not speaking for our non-US IMGs because I do think you need to rank probably more programs than the US medical grads. But they actually stratify by different applicant categories as well. But if you look at that, the average medical student and the match rate was like well over 95%. And nobody went out of matched applicants. No one went lower than 10 on their rank list. So if you think about it, you do not need, unless you have specific challenges that are going to make it hard for you to get interviews and to match in general, you're really not needing to interview at 60 places. You're needing to rank, 9 or 10, right? So if everybody kind of scaled it back, then we would be able to tell better sort of who is interested. And so my advice based on our statement and just a little background on that, and I don't want to talk too long because I don't want to take up too much of other people's time, but just I encourage you to read it. The consensus from program directors on that statement, because it went to all of us, child and adult neurology program directors, is that the consensus was well over 95%. I think there was one no from all programs. I won't tell you which program, but all of our program directors agreed to these guidelines as just in general. And they're pretty general, but I think it's really important for our applicants and our program directors to all review them carefully. And that's really kind of what we came to as a consensus. So I encourage you to look at the link and read it. And I also want you to know that our goal as program directors is not to make this hard for you, right? So keep it simple. I think if a lot of these questions tonight have a similar theme in terms of what are we looking at? What do we want? And how much does this matter? And how much does that matter? We want to find residents that are a good fit for our program as much as you want to find a program that's a good fit for you. All the programs are different. Every program director reviews applications probably somewhat similarly, but every program is different and every program director is different. So you're going to get, if you asked 170 adult neurology program directors exactly what they do, you're going to get 170 different answers. But I think what we all have in common, and I'm going to generalize here, is that for the most part, because I know almost all of them, is that we're nice people and our goal in life is to train neurologists, right? And we want people that are excited about neurology. We want people that are going to display on their application who they are as people. So it's not like we're looking for one specific adjective. We're looking for who are you? What's meaningful to you? What are some things that you've done in your career and in your life so far that really contribute to your values and contribute to who you are? And that's what we want to see. And if there's something that you have a preference for, like if there's a geographic region you really want to live in, put that as a preference. It's not like, don't try to game the system. If you have a preference, put it. If you really have no preference, if you live overseas right now and you really don't care where in the US you want to relocate, put no preference. I think, the idea is that we just want to know you and kind of read through your application as a whole, and then just really try to figure out if it seems like you would be a good fit for our program. And I know everybody says good fit, but every program has a different vibe. And I encourage you, before you apply broadly, to really look at what we've posted, right? So we try so hard to give you a good sense of who we are through our websites and through our social media and all the videos, virtual tours, and all that stuff. So I encourage you to look through all that and really do some research on the programs to really narrow it down and, figure out your top 3 and signal those, and then kind of really go from there. So I'll stop there, and unless you call on me, I won't talk anymore, but that's kind of what I wanted to say.
I mean, I'll add to that, to what Dr. Schuyler said. I think the most important thing about your application is that you are as authentic as possible, because it does not do you any favors to try and make yourself out to be someone you're not, to try to get to a program, or like Dr. Schuyler said, game the system. You want to be at a place that you're going to be successful, and we want residents who are going to be successful. So trying to, finesse I think they want more research, so I'm going to highlight research. If that's really not something that you've had a strength in, then, don't try to, then don't highlight that. Highlight some of the other things where you've had leadership experience, where you've had education experience, things that you've really sunk your teeth into that you're passionate about, because that comes across to us. And that's, I think I speak for all of us, that's what we want to see. We don't want to see somebody who's trying to, put up things on there like, what do they want to see? How am I going to impress them? I think just being yourself and finding programs that really feel like I could succeed here, and then putting that out and why you would succeed there. I think that is the most important thing.
Yeah, I'll echo that too. We always get asked, what's the right fit for you? Or what are you looking for in an applicant? Well, I don't have a cookie cutter look. Like, I'm not looking for something in particular. I'm actually looking how you would uniquely contribute and come to and bring to our program, right? Because that makes them really the nicest combination. So really highlight like what do I want to get to know about you and be excited about you. And I love how the new application allows you to do that in more depth with things like meaningful experiences and gives you a little bit more room to highlight everything that you're bringing to the table.
Thank you all so much. I'm going to pass it to Nancy for our next question.
Our next question is regarding the style of descriptions for the experiences section. It asks, is there a preference for bullet points versus paragraphs to describe our experiences?
Is this for the meaningful experiences?
For all of the experiences and also the impactful section.
For the meaningful experiences, what I've seen mostly people do is paragraph. Like there's a dialogue around kind of explaining what people have experienced and how that has impacted them and kind of what they've walked away from. So I think it works better when you put dialogue around it, as if you're just sharing a story with somebody. And I think those dialogues read better than probably bullet points do. I don't see a whole lot of bullet points on the applications. They tend to be more dialogue more than anything. And then what I will say for also your personal statement, you do want to read well. Some people get creative in a way that doesn't lend to reading a statement well. So you really want to, again, it's a story, that you're sharing, and you want to make sure that somebody in medicine has read it, but also somebody who's in literature that can actually write and can read it like a story, because that's really helpful. We can be very kind of clinical in the way that we write things, but this is really your place to highlight your story. And yeah, why neurology, but why you in particular?
Okay, I saw a lot of head nods from the other PDs as Dr. Duffy was answering. If nobody else has anything to say, we can go ahead and pass it over to Andrea.
Thank you, Nancy. The next question is regarding research. How important is research for neurology programs?
So I think that's a question that's going to be different from one program to the next. In my scenario, I work for a self-standing children's hospital that has a huge research division that's tied to 3 different universities within Kansas City, because all of our children's patients are taken care of in one place, even though we live on, our city sits on 2 different states where we are. So it's a very unique place where there's a lot of different research opportunities, but I am very much the type that wants to train clinically interested individuals while still offering research for folks. And so I think, again, it's about striking that right balance with each individual candidate, but also on your side, finding that balance with the type of program that you're looking for. There are lots of programs that are going to be able to offer you training to be a great researcher, but those same programs may be able to look at you differently if that's not what you're interested in. One of the things that we've done in the last couple of years to sort of reinforce that with our residents is we created a private practice elective that gives them an idea of what that private practice world is like. We have them go out into the real world to experience that and see, in pediatric neurology, our closest private practice folks who we love, they're folks who see more people in a day who we do. than we do in our higher acuity center. And so it's a great way to sort of show people that you're interested in not just their research, but their clinical ideals as well. You just have to look at each individual program and whether or not research is something that is a requirement of every one of their residents for them.
So I agree with that. I don't see not having research is a drawback, but I see like if someone has publications in neurology, it just reinforces that they're passionate about the field that they want to join, and that's how I look at it. And almost all of our residents participate in some kind of research. It's not that we enforce them to do that. You have to participate out of their interest. If they want to participate in research, we will make avenues for them to excel in that. So bottom line is, it's not that it's something extremely required for you to be a competitive applicant, but if you have it, it helps.
And I will agree with what's been said, but just I think the key is to really, if research is really important to you and you've done a lot of it and you want to continue it, then I think it's really critical for you to hone in on the programs where research is a very big focus, because they're all over the map. Our program is not really research focused. Again, like our other program directors have said, we make it happen for those who are really interested. But if it's about, trying to finesse things and trying to make a program fit when it's not quite a good fit. So I would encourage you, before you're applying, to really, if you really, really want to go to a research heavy institution and you want that to be a major part of your training, to really try and research the programs, pardon the pun, ahead of time, to make sure that it's going to be a reasonable fit. Otherwise it will, it's only going to help your application, but it just may not be exactly what the programs are looking for if you're looking at a program that's fully clinical and doesn't offer a ton of research, if that makes sense.
Thank you all so much. I'm gonna pass it to Neha now.
Thank you, Andrea. So our next question is, what other elements can attract programs if the scores on an application are low?
Making sure you give yourself credit for everything that you've done. So you've got volunteer work, research, and work, right? And you just want to look at everything that you've done and make sure it's included in there. So I even say, for example, if you're a barista for a couple of years, include that, right? Because that's interpersonal communication skills and problem solving. And, there's a lot to be said about that. That's life experiences. And often people will get kind of focused, oh, it's just kind of whatever I've done related to medical. But no, some people have been engineers before going back to medical school. So look at that, right? Some, Peace Corps, you were in the military. Like a lot of you just have some really interesting stuff that they've done. Community outreach stuff, working in different populations. So just kind of think about all of that and make sure that you're highlighting that. And then there's a kind of the newer section as of last year that it's now embedded in the application. It was in the supplemental, where you can pull pieces out of your application and highlight like why this one, hey, I really want you to pay attention to this experience because it was important to me for blank reasons. So there's just a lot more flexibility in the application to highlight what you've been doing outside of just pure scores, right? And all medical schools and programs are really trying to get away from the traditional the markers such as board scores and class ranking and AOA, because it leads to inequity, right? Everybody has different life experiences. So just make sure you're spending time on those other pieces of it.
I can chip in. When the board asked to comment on the triple digit score, I'm the first person to jump down to write the comment saying, like, please take the triple digit score out of the way. Because in my personal experience, I don't want to put the students on the box saying, like, I don't want to judge you. If you have a low score, you're not knowledgeable. I have many people in our experience, we have seen 260s, 270s, not having great communication skills, and have seen residents low scores. They're one of the greatest neurologists that they're faculty with us as well. So when you have low score, there are programs who's going to look into that because so many applications, someone has to look into that. So then you sell yourself. There's so many things that you have done, and you have crossed so many hurdles to get to where you are today. And it's not an easy job. I went through the same path. I went to med school. I went to interviews. I went to the residency path. It's not easy. And you have good qualities, great qualities to get to where you are today. You just need to find a niche to express that. As long as you can do that, you're on the game.
Thank you so much to you all for answering. What were you about to speak, Dr. Allison?
No.
Okay, gotcha. Sorry.
I can, but I wasn't intending to.
Okay, no worries. Well, then I'll pass it on to Haley for our next question.
Okay, so our next question is, can you speak to the importance of program signals? Specifically, how likely are programs to extend interviews even without a signal? And does it make sense to signal a program that we did an audition away rotation at?
I can take this one, I think. So like I said, there's a lot of programs, and I think every program uses signals differently. If you think, and I've talked to a lot of program directors about, because last year was the first year that we used them. And some program directors were like, I never even looked at them. And some program directors were like, oh my gosh, it was such a big help. It totally helped me narrow down, to figure out who was interested, because I got 500 applications that all said, for example, New England geographic preference, and then 100 of them signaled me. And so I think I think it really just depends on each program and how many signals they get and how many applications they get. So, and that's going to vary across all programs. So there's not like a blanket answer of how signals are used. You have 3. So what I would say to do with them is to pick the 3 programs that you really want to, to let that program know that you're super interested in an interview there. So don't overthink it. That's my advice. Don't try to like play a game with it. And, I'm going to send one to my safety program and I'm going to send one. Just pick 3 that you want the program director of that program, in case they are using the signals and weighing them heavily. And we might not know that until we actually open up our ERAS next Friday and see that, maybe I only got 1 signal, like maybe only 1 applicant has signaled me, right? Or maybe like 800 have signaled me. Like, I think it's going to vary depending on how many signals we get. In terms of if you're a medical student and you're applying to your home program, or it's a program where you have done an audition rotation and potentially have gotten letters from that program and stuff like that, I think it's important that you communicate with that program directly in terms of if they're going to give you an interview either way. Okay. So for example, the medical students at University of Connecticut, I told them specifically, they do not need to use a signal on my program. I'm going to interview them all. Okay. So, and I think many program directors are doing that. And in the guidelines, we do say that we encourage communication between programs and applicants regarding that specific topic, because there's only 3 signals. So I think it's worth having a communication, like if you're doing an audition rotation, to find out if a signal is necessary. Obviously, if you're doing an audition rotation like 2 months from now, and you need to enter your application now, it probably would be a good idea, if you really are interested in that program, before you even do your audition rotation, to use it ahead of time. But I think, and like I answered in the chat, all things being equal, I think if 2 applicants had absolutely equal applications and to a program, and one said to signal and one didn't, I do think that overall signaling the program is going to give an advantage over not having signaled that program, all other things being equal. I think that if you're sending a signal and you wouldn't have qualified for an interview, or if you wouldn't have gotten an interview either way at that program, you probably wouldn't have gotten an interview either way at that program. But I think for the applicants that are sort of competitive, or seem like a good fit for that program, one with a signal versus one without that would help. So, and it certainly helps program directors. If we are trying, for program directors that use them, it may help in terms of, for example, if they filter by who signaled them, then you could actually potentially read those first. Like, let's say I have 150 signals, maybe I'll read those 150 before I read the other 900, whatever. So I think, you know, that hopefully that answers the question well enough.
Yeah, I agree. I think what I recommend for most medical students is take those 3 signals and use it to tell your top 3 programs that you're interested. And home institution folks don't have to signal their home institution. It's variable for visiting medical students. So you might consider signaling, but you can have that discussion when you're at that institution, whether you need to or not. But when I'm looking at the applications, I'll note, okay, they signaled me versus not. But if there's a great candidate that I want to interview and they haven't signaled me, I'm going to interview them. And just because they signaled me doesn't mean they get an interview. So I think it's much like noting whether someone has geographic ties, right? You will note that because we do know that all programs tend to match people that have geographic ties. Not always, but there is a strong pull toward that in picking programs. So it's just the things that you know.
Okay, thank you guys. I think that provided a lot of clarity around the program signals for sure. Our next question will be by Gabrielle.
Okay, so our next question is, would an application without USMLE STEP scores but with COMLEX scores be considered?
So I think that's another
Of course.
Yeah, so I think that's another program to program specific question, but within mine, it wouldn't even be a thought. Yes, DOs are doctors, no, full stop.
Yeah, it's a licensing exam, you know, and you shouldn't be redundant in having to take USMLE step 1 and step 2 and COMLEX 1 and 2. Like, please do not take all 4 of those exams. Like, please don't do it. Any program that is going to screen out a COMLEX without a USMLE doesn't understand the training process and probably is not a program that you would necessarily want to be applying to. Like, we should all know not to have our DO applicants take both.
Save your money for something else, more fun.
Totally.
And I'm not saying there's no one within my my program or our pediatrics group that would ask me why there's not one, but my answer is DOs are doctors, full stop.
Agreed.
Awesome.
I think, yeah, it doesn't matter what you took. You took a board licensing exam. You only need to take the 1. You don't need to take 2. That's just torture. As a DO myself, who took 2 many moons ago because it wasn't the landscape of things, it's not necessary. So please don't take both, and value your scores and what the board certification that you went through.
I echo Dr. Schuyler's sentiments. If someone is not going to interview you, call you for interview because of your COMLEX score, they want to see the STEP scores, you don't want to go there.
Mm-hmm.
Yeah.
Great, thank you guys so much. We will move on to Nancy.
Our next question asks, what type of letter recommendations do you guys find to be the most impactful, whether that be from neurologists, other mentors in the field, PDs or department letters, and do letters from virtual rotations count, or are they weighed as heavily?
So I absolutely love the personal statements, but I don't know if there's like a formula or recipe, because what I like is just your own individual expression, and some can be written, I mean, like completely drastically different, and I'm equally happy with each one, right? So I think really conveying for us, like, the love of pediatrics, right, and pediatric neurology and neurodevelopmental disabilities is really important, and however that is conveyed in your own style and your own voice is the most important, rather than kind of being more scripted. So and I think there was a second part to the question. I'm sorry, that part I forgot. So
I think it was about who are the best people to get letters from. Is that is that the other piece to this?
Yeah, exactly.
Yes. Okay. And so to me, it's the people who know you best. I would love, if every single person here had the highest ranking member of their division as their best friend. Wow, that would be lovely. But if that person doesn't know you, don't get a letter from them. Get a letter from someone who knows you and who can really tell me a story about you. When I read a letter that tells me about an actual patient that you saw that was complicated and that you did well with, that means 10 times more to me than someone who read your dean's letter and made some annotations in a letter of recommendation.
Yeah, very much agree with that.
Yeah, I 100% agree. Have it be someone who you know and knows you and knows how you are with people and patients and teams. You do want some of these letters to be from clinical faculty that you've worked with, right? That you've really kind of been able to show what that looks like when you're in those different dynamics. And, in other places, if you have, if you're a MD, PhD or DO PhD, that someone who's been involved in as your research mentor is important. I think it's important to have obviously letters from neurology, but internal medicine can also be helpful because you do a year of internal medicine as well. So some of the things to think about. People often say, oh, well, does my chair need to write me a letter? Well, the chair, frankly, doesn't usually ever personally get to know people as much as other faculty. So again, have it be someone who knows you, not that has a title.
Right. And there's a question in the chat also for our non-US IMGs about letters from your home country versus from the US. And I think it's important. I think having both is fine. I wouldn't have all the letters be from your home country because I think it's important to have at least one or two of them be US letters to address your clinical skills and sort of your knowledge of US healthcare system and things like that. So I think, you do want to have at least one letter from somebody in the US that can speak to your your experience in the US, because I know that most of our non-US IMGs who are matching in the US do have some US clinical experience. In terms of from a virtual rotation, if that's the type of, if you've had an experience with a faculty preceptor in a virtual rotation and they can really speak to your clinical skills, so if they've done a bunch of virtual visits with you, they've seen your patient communication skills, you've done some presentations to them. I think that that's still worth getting that letter if that's somebody who can really speak to your abilities and your teamwork and your communication and your professionalism. I think it's better than asking somebody who doesn't know you that well. So I think the key is really to pick the people that are really going to be able to speak to your abilities and to your personality, and really, write you a really positive letter that's more personal. And even if that, we said neurology and internal medicine probably are the most important just in terms of the specialties, but let's say you had you worked with a pediatrician or OBGYN or somebody in that, or a surgeon, and that's who really got to know you and you did a lot of clinical work with, you should absolutely have them write a letter. So, and that would be stronger than potentially from, let's say, a neurology department chair that's just going to write might write something generic if they don't know you that well.
And I would just add that there are still some programs who are trying to get away with this, and this is in the AAN consensus statement, that have some requirements that it has to come, you have to have letters from a program director or a chair. We're really trying to get rid of that in the spirit of equity, because not everyone has those experiences or those abilities to work with those people. So I would say check ahead if you're, wanting to apply to a program, but most programs, I would say, and I think everyone on this call is really trying to get away with that, from that, and really trying to focus on getting letters from people that can speak to you as an individual, as opposed to just a name on a form that says, I don't know this person, but I worked with them for a week and they seem okay. I don't find that helpful.
I know we're limited on time, but I want to emphasize, please do not get the letter just because of the title. So get the letters from people who knows you the best. It doesn't matter what background they are from, because we are not trying to hire a well-trained neurologist. We are trying to hire students who wants to be trained in neurology. The bedside skills are the same irrespective of the field you're entering into. Your professionalism is the same. Your intercommunication skills is the same. to try to get the letters from someone who can speak about your experience with them, and who can give you a story. If you go to your chair, they're going to write 3-4 lines. It's not worth it. I've seen so many letters. They don't have time to change he or she, and then I see them using the same template, changing the name in a different font. It's just it's not going to help you. You put in so much effort to get this thing. You need to get it right. Get it from people who knows you the best.
There's a question that just came up in the chat that's asking if research mentors are also reasonable, or should we have more clinical letters? And I personally, I think it comes back to the piece about how well they know you. If this is someone who you've done research with for years, yes, you should absolutely use that letter. And if it's somebody who you did research with for a month, you should weigh that as heavily as you would with somebody who you worked with clinically for a month. But I do think having some clinical, even if you are someone who really wants to do like even a science-based track of neurology, having some clinical in there is going to help you. But you definitely want the research mentor as well if you have a good one.
Thank you, everyone, for that very comprehensive answer. For our next question, I'll pass it over to Andrea.
Thank you. The next question is about how to get to know a program before interviewing. Like, what are the key things to keep in mind about fit regarding a program?
I think a lot of us, I mean, we try to keep as much information on there as we can. It's hard because we have so much to do. So, you know, and especially this time of year, we're working on getting our new residents like up and running, right? So it's hard to like put the website updates at the top of the list, but I think we do our best. And so I think just in terms of which pieces are important. So look at the residents, right? Look at the current residents. I think if I were going to pick, if I were an applicant, I think the most important is the current residents. We try to put as much information as we can about our residents. Obviously, we don't want to like divulge like to, you know, their privacy or anything like that, but we have them each write a paragraph about themselves and where they're from and what they like. So we try to put, you know, some information about them. I think also looking at the faculty, like, you know, looking at the size of the faculty, kind of like the composition of the faculty across subspecialties. If there's a certain subspecialty that you really have an interest in, like let's say you're really interested in neuro-ophthalmology, like maybe look at programs that have strong divisions in neuro-ophthalmology, because not every program has 10 neuro-ophthalmologists. Some might struggle to like have 1 or 2, but some, you know, so if that's a strong interest, then look at that. So really it depends on what are you looking for in a program, and having an idea of that going in, right? But I think, you know, looking at the residents, and because you want to meet them too. So you kind of, you know, just having information about them. And then the other information, there was actually a paper about this not too long ago. I think it was maybe actually it's probably 2 or 3 years ago now, where a group of people analyzed program websites and had a checklist of all the information that was on it, and then had a list of what applicants wanted. I forget, but you know, there was a whole list of topics, and I think a lot of programs actually had most of them. And one example that I didn't know of when I read the paper was parking. So that's something that, you know, you want to know, I guess, if programs have free parking, or is that something you have to pay for? And also you want to know, do you need a car? You know, so my program, like, it's much easier if you have a car because people are driving around suburban Connecticut, and it doesn't have like a big subway that goes around to like every clinic that our residents go to. Whereas if you're in New York City or Chicago, you know, and you don't drive, it might be better, like if you don't have a driver's license and you don't plan on getting a driver's license, then that might be something that you're looking into on websites. But I think a lot of us have put a lot of YouTube videos up. We've put virtual tours up. I mean, so there's so much information out there. So I think, you know, look at the website to kind of narrow down in terms of like your specific interests. And then if there are programs you're really interested in, then just take some time and look at the videos the residents have posted, or look at, you know, their Instagram, and look at their Twitter or X or whatever, like posts, what, you know, I don't know what to call it, but you know, I think there's, you know, we just try to keep our information current. And so I think it looks good too. I'm just going to give you this as a hint too. If you come prepared to an interview, like we can tell if you research the program, if you have specific questions based on looking at our materials, I think that's a good thing. Okay. As opposed to, If there's information very clearly outlined all over our website and you ask a general question that's very clearly answered sort of on the first page of our website, then that might not look as good as the sort of well-directed question about a specific thing that we posted, you know, so I'll just give that as some advice too.
And I'll add to that advice for, oh, sorry.
Please go ahead. Go ahead.
I've dominated like the last 3 questions. You go.
Oh no, I've dominated some too. So go ahead. I'll go after you.
So I was just going to add that when you're talking about all of these different aspects of the program, on that, when you get the interview, when you have the interview day, knowing who you're interviewing with is also incredibly helpful to you as an applicant. If you have looked at all the publications that Dr. Schuyler wrote in the last year, and you don't want to come in and kiss up, but if you have legitimate questions about how that interacts with her residency and what that does a lot to the people that you are interviewing with. I don't need people to blow smoke at me, but to show that you have that much interest in the program to look that stuff up ahead of time says a lot too.
Yeah, and I will say that, take time during the interview to get to know the people, right? Like you're there to kind of feel the vibe and get the energy from the program and see if like, hey, I want to join this group of people for the next number of years. So, the many of us will have social hour with the residents before the interview day. We have what we call coffee talk or breakout sessions where you get to spend time with the residents in between your interviews and meet other faculty. And then you get to see how they interact and how they are with each other. And then those social hours with the residents is really your time to ask all those questions without us there, right? How do you really feel about the program, or what's the support look like, or how's living in Sacramento? So that face-to-face virtual time is really important, and you can get a lot out of that.
I agree.
Wonderful.
Please know
Thank
about
you.
the program, and then please know about your
Sure.
faculty as well. Every time I start an interview, I tell the candidate that I read your application. These are the 10 things that impressed me. These are the 5 things that impressed me. And then the student goes like, so what do you do? And if they don't even know I'm a vascular neurologist, it's just a little bit off-putting, right? So I want to have a conversation. I'm telling you because you put in the application, I took my time to read. I want to know you more. And then if you don't know about the faculty that are interviewing you or about the program, that goes against you. So I would strongly recommend knowing the program before you go for the interview.
Thank you so much. Now I'll pass the next question to Maya.
Thank you. So our next question is about personal statements. We combined it with a few questions from the chat. So the first is, how long should the personal statement be? And also, is it advisable to use program-specific personal statements or to mention family ties in the area?
I'll take this for a second because I have strong opinions about how long the personal statement should be. No more than 1 page, please. We read a lot of personal statements, and 1 page, you can say it all, but my eyes will start to blur after 1 page. And my guess is most other people's will be too. So say what you have to say and be kind of very clear about it. And then in terms of personalizing the personal statement, if there's a program that you really want to go to, you can do one for that one. But we can tell when you've written something and then just made a sentence saying, I'm interested in your program and the opportunities, and that program's name just gets changed for every program that you're applying to, it's not worth it. Right. But if you really want to say, my family's in the area, I want to come back home, like my support's there. That's why this is, my #1 program, or you have this particular thing that I'm interested in. Sure, it gives you another place to really get a shoe into a place that if you're like your heart's set on that place, but don't do it for every program. We can tell it doesn't mean anything to us.
And I would just, I agree 100%. I would just be careful if you personalize it and make sure that you send it to the correct program. I have received, I would love to train at, and then it doesn't say University of Rochester. So or if you're talking about all the the subway system, and then I know you're not really talking about Rochester because we don't have one. So just if you're going to personalize it, just be very careful that you do it correctly.
Or if you CC all the program directors rather than blind CC them. That's happened. So there's been a couple comments and questions about AI. And interestingly, I think it was at our clerkship director, program director course this past year at the AN that somebody read an AI generated statement. And it was so generic sounding. So I don't think, I mean, the whole idea, and I don't run it through an AI checker. I don't know which program director is using an AI checker, but I don't know how to do that. I'm not technologically oriented at all. Like I can barely get on Zoom, but if the whole idea of a personal statement is that it's personal. So, I mean, I don't know. I mean, maybe AI is good enough to write a letter that you feel is like your heart's expression, but I don't think so. So, we like Colleen and the other program director said, we read a ton of these. So I've been doing this for 15 years and I actually interviewed as a resident and fellow. I was on our application recruitment committee at University of Michigan. So I've been doing this for like 20 years or something like that. So all the essays I've read, I skim them and, if something is well written and meaningful, there are a handful that really just move me every year. And I'm saying this after doing this for 20 years, there are a handful of them every year. So out of 1,000, there's a handful. And I read that essay and no matter what the rest of the application looks like, I want to meet them, right? So obviously that's not the majority of the essays. A lot of them are just kind of neutral, or they're great for generating information for the when we're interviewing you. We use the personal statement sometimes where it's a good essay and it tells us about you and it's interesting and stuff like that. But there are just a couple of them that are just so moving that like either I'm in tears reading it or something about it just I just really, really want that person to have a conversation with them and learn more about them and get to know them. So that's probably the aspirational personal statement. But I think in terms of AI, I don't know that it's going to write sort of that kind of expression. I really don't think it would.
I wanted to say one thing, Erica, that made me think of it. In your personal statement and also in meaningful experiences, make sure what you're sharing, you're okay talking about. So anything that's in your application is kind of free game to talk about. You're sharing it with us, you're sharing that experience. So if it's something that's very near and dear to your heart, that's kind of a vulnerable place to go, it's not something you're really going to want to talk about on your interview day. People have dealt with their own disabilities. People have lost parents and siblings. There's been, growing up with different socioeconomic backgrounds, working through school, whatever that is for you. We want to hear all of these things, but if it's too raw to talk about, you might not want to mention it. Just throwing that out there. I've seen a couple kind of things happen during the interviews.
I see a couple of comments asking, are we going to check using AI? I don't have time to copy and paste from the PDF file to see whether it's AI generated or not. I'm not going to do that. But let me tell you, in my experience, I never had a chance reading a letter of recommendation or looking at the scores that I want to see this person, I want to meet this person, but personal statement made me do it. There are many personal statements made me cry. Many personal statements made me humble. And then I got to have one or two more shots after reading the personal statement. And I have seen faculty sending me bold letters in the email. You have to call this person for interview. It has to be personable. It doesn't need to be like 2-3 pages, one paragraph. Just tell them who you are. And then you don't have to say like most of the IMGs ask me this question, do we need to say, do we use a paragraph for why I want to come to US? You already applied to the residency program in the US. I know you want to come here. So if you have other things to say about you, who you are, you don't have to waste space to say why you want to come to US. Okay. So personal statement is extremely important.
Thank you all so much for that thorough answer. I'm going to pass it to Neha for the next question.
Thank you, Maya, and thank you all for answering all those questions. So we are at the hour mark now. So I just wanted to check in because we've had an influx of questions coming in. Is it okay for us to continue for another 10 minutes? And if not, that's also totally okay. If you need to leave for whatever reason, we respect your time and are really grateful that you're all here. So let us know, or you're able to leave the chat, and whoever wants to stay for the remainder of 10 minutes is welcome to continue. We're good? Okay, so I'll ask the question. If you have a variety of leadership and research experiences, but they are not necessarily neurology related, would you question the applicant's interest in neurology?
No, I think go ahead. Sorry, Sarah.
No, you go.
No, it wouldn't question it. Sometimes people change their mind, right? So sometimes they're, found a mentor, the mentor's in infectious disease and they've done a lot of research in infectious disease, and then they find neurology and then they're interested in neurology, and maybe they found it later because it's not a fourth, it's in their fourth year. So I don't mind. I think any experience adds to the collective part of your experiences, and it wouldn't put me off. I find it interesting.
Yeah, that's exactly what I was going to say, is that I completely understand not maybe having exposure, not being necessarily aware of your interest in neurology, and then that buds later. And I think still learning about kind of your work ethic and your passion and your drive and what you did in your research in any other department is still incredibly useful. And of course, I understand when you learn about the brain, why neurology then becomes, your interest. So.
I'll be fist pumping when I see that one more neurologist to the pool, so it's a cool feel. I have one more person, one more colleague in future, as simple as that.
Thank you all for answering that question. I will pass it on to Laura now for the next one.
Hi, so this next question is regarding contacting the program directors. I know during this time that your emails are more flooded than usual. Is it advisable to send a letter of interest to some of your really, really top programs, or is this a time to just submit your application, signal geographical preferences, etc.?
I would say the second. We just try to put yourself in our shoes. It's a ton of applications. And if you applied, that means you're interested. Okay. So if you applied to me, that means you're interested in my program. That's the default. And if you signaled me, that means that I'm in your top 3 of who you're interested in. So I think that's really where it needs to be. And we do get flooded with emails. And so to be honest, I think it's hard for us to even go through them all. So I think we really, especially next Friday, once the applications open, we're going to be doing that. So just consider having clicked submit to that program, your contact with us.
And I think that you're asking about letter of intent too. I think that comes up a lot. We've gotten a lot of letters of intent now in the COVID. It used to just be an email toward the end of the cycle saying, I'm really interested. You're in one of my top programs. They don't really mean a whole lot to me anymore, because I've gotten a lot of you're in my top programs, and if I had been, you would have matched with us. So what I advise people is, if there is the program that you absolutely wholeheartedly want to be in, it's okay to let that program know, you're my number 1 program, or you're where I want to go. We can't tell you where you're ranked in our list. We're not allowed to. That's not part of the process. But if there is a program that truly is home and where I want to be, it's okay to send a letter of intent or let them know that, to remind them at the end of the interview season. But don't send a bunch to you're in my top. I don't know. Am I in your top 3, 4, 10? So that's my advice.
Yeah. And I think, and I answered in the chat also, that post-interview communication is not necessary. And I think a lot of program directors are going to tell you that in the interview. And if they say that, assume that they mean that. Thank you letters are not required. So there's no requirement for post-interview communication. I believe our guidelines do state that as well, that there's no, required post-interview communication. I think what most program directors do, obviously, to be polite, if somebody sends me an email, especially if it's very specific information, if they send me a specific question that they really want to know the answer to, I'll reply to that. If they send, if I get an email then I'm usually, I'll reply and say, thank you for sending that email, just, because I try not to just leave emails unanswered, but it really should not affect your ranking. So and I tell I say this every week when I finish off my interviews, that we have all the information that we need at this point. Don't feel obligated to contact us in order to be further considered. Second looks as well, those are really not meant to be used by programs to decide who's interested. So second looks are really for information for the applicants to help them decide between programs. So after you're done interviewing, I think the second look events, and I think a lot of them are virtual. Most institutions have decided not to do in-person second looks, but some may have. Do not feel obligated that you have to go visit a program in order to be considered. All right, it's really not that's not the reasoning for it. So I just wanted to mention that also, because I think second looks are a little bit controversial, and we did address that to the extent that we could in the position statement.
Thank you for answering that question. If there's no one else that would like to respond to that question as well, I think we'll send it off maybe to our last question with Gabrielle.
So last question of the night. Do you have any advice for applicants couple matching through NRMP? Are neurology programs typically open to communicating with other specialties at their institution about couples?
My guess is most of us will talk within our institution. So when I get couples match, I look at, our level of interest too, and reach out to the programs and check out their level of interest, and if we can duly offer them interviews. And there's different, so yes, we talk.
Yeah, we definitely talk. And it's also for the interview invite decisions too, because if I have an applicant that I invited for interview and, let's say the partners in pediatrics, I'll definitely be in touch with the pediatric program, and vice versa. If somebody has interviewed somebody in their program, and this has happened before, that someone's high on our wait list for for interviews, and they contact us, they said, we interviewed the partner, we really love them, it seemed like they're really interested in our program, and then I look back and they're right near the top of the wait list, then I'll pull them in the next time a spot opens. So there's definitely that communication regardless of specialty. And we've I think all program directors want to if both partners are really strong and meet the qualification for interviews at the programs, then it's very helpful for us to kind of communicate back and forth about that.
I agree. Most of us have families. We do understand how important it is, right? So the life outside the hospital is as important as what you do in the hospital. If I see somebody couples matching, even before they come in for interview, I do email them and their couples program and ask them hey, what are you thinking about this candidate? This is the AMC idea or whatnot. So I think most of the program directors do that.
Awesome, thank you. If no one has anything else, then I will pass this along to Haley to kind of give our closing message.
All right, thank you, Gabrielle. So I'm just going to go ahead and make a few ending comments. I just want to thank all of our attendees for being here. Hopefully we were able to get some of your final questions answered as you make the finishing touches on your ERAS application. And then a special thank you to all of our program directors. I know you'll have a busy schedule, so we really all appreciate you being here and taking time out of your busy schedule to answer all of our questions. We will be posting to our socials the recording of this meeting, so be sure to keep an eye out for that. And so at this time, we'll go ahead and conclude our final PD panel, and I hope you all have a great evening. And again, thank you all for coming.
And thank y'all for arranging this. It was really awesome.
If I can say one final word, please do not be anxious. That's what's going to hurt you during the interview process. You work so hard to be here. It's like one final step. Be who you are, and then showcase your talents. and then see, hey, 10 years ago, I was like in the same position I'm the PD today. So like, look at people, look at your mentors, talk to them, just be relaxed. You'll be fine. I'll be wishing good luck to all of you. I know like there's 160 people, but I have only 7 spots. So you will match, don't worry. Okay.
Yeah, good luck to all of you. And I wish you a lot of fun doing this too. It's really exciting time, you know, and it gives you the opportunity, if you're interviewing at different programs, to like meet program directors and faculty and other residents from across the country. And so I think really, you know, try to enjoy it as much as you can. It's exciting, and you want to really find the residents that, you know, your co-residents are potentially going to be your friends for life. You know, I'm still really close friends with many of the people that I did residency with a long time ago now. And, you know, it's fun, and we're a great community, I think. And so even people from programs that you don't end up going to their program, you might make a connection with them and then see them at different meetings or different conferences. And you're just, you know, you're still networking even with those other programs that you don't end up attending that program. So wish you all great luck and have fun with it.
Yeah, 100% agree. And if you've been invited to interview, gosh, we're already impressed with you. So like others said, just be yourself. We're super excited to meet you. And it's really your day to shine. So look forward to meeting many of you.
Thank you so much.
Good luck, everybody. We'll see you on the interview trail, hopefully.
Thank you all. Stopping the recording now, and then I'll end the meeting.